Welcome back to another edition of No Shave November. I'm Pat Osterman.
I'm Dr. Edwin Card.
We thank Dr. Card for coming out today and joining us as we continue our month-long No Shave November in cancer awareness. So Dr. Card, not only do you serve as a general surgeon here at MDH, but also as chief medical officer. What do you want to talk about today as far as cancer awareness?
I'd like to talk about colon cancer. I think colon cancer is a very, very important topic. It's the number 3 most commonly diagnosed cancer in the United States. And the thing about colon cancer, most of our cancer screening is done in order to catch cancers when they're early, when they're easier to treat. Colon cancer screening, however, is completely different in that if we can do screening, colonoscopy, identify polyps and remove polyps, there's a very good evidence that this actually prevents the formation of cancers in the first place. That's far more helpful than identifying a cancer after it's already developed. Colonoscopy is relatively simple. The prep is not always pleasant, but it is rarely terrible. And it certainly is far better than treatment options.
As an experienced surgeon, I know you've seen a wide range, not only with colon cancer, but other cancers. With colon, this is probably one of the most preventable ones, would you say?
It is absolutely preventable. And the treatment is almost always surgical with resection of the area of the colon that the tumor arose in, as well as the blood supply to that segment of colon and the lymph nodes that drain that area. That provides both a better prevention for recurrence and some prognostic information about whether or not the lymph nodes are involved with tumor. That information is then used to determine whether or not chemotherapy is required in addition to the surgical resection.
Now, as we said, as a general surgeon here at McDonough District Hospital, what are some of the other services that you do with general surgery and some of the areas that you may cover?
Right. I've been doing vascular surgery here in Macomb since 1984, doing carotid surgery as well as replacing aortas and doing bypass grafts. The movement over the last couple of decades has been away from open surgery and more to the use of what's called transluminal therapies. These are stenting and stent grafting and other interventions that are done through the channel in the artery with a catheter. We don't do that so much here, but we still have a certified vascular lab which provides diagnostic services. I continue to see patients with vascular disease in an attempt to identify whether or not they would benefit from an intervention rather than sending them away for an intervention that they may or may not benefit from.
So as we're talking No Shave November, beard's looking pretty good.
It's only about 30 years old, so it's had time to grow in.
It ages well, right?
Except for the color.
Well, again, we thank everybody for joining along throughout the month of November as we bring cancer awareness to everyone's attention, and we appreciate Dr. Ed Card, again, Chief Medical Officer, General Surgeon here at McDonough District Hospital, for taking time out.
Happy to do it. Thank you.
For Dr. Ed Card, I'm Pat Osterman. Stay tuned. We will have another edition of No Shave November for you here soon.